There is one that I didn't mention, and that's because we're going to talk about it right now. Another freebie today is coming courtesy of the Radiology Associates of Hartford. They're celebrating Veterans Day by offering free lung screenings at all 3 of their Central Connecticut locations. You see, lung cancer, we don't talk about it much, but it is the leading cause of cancer death here in the United States. The American Cancer Society estimates that it accounts for nearly 30% of all cancer deaths in the U.S. each year. So to talk about why a lung scan is just so important, I'm happy to be joined now by Dr. Michael Biondi. Thank you so much for being here, Doctor.
Thanks for having me. I appreciate you.
Yes. Okay, well, let's get started. I know we've talked about prostate cancer in the past, colon cancer. Lung cancer, pretty much, as far as mortality numbers, has all those combined and then some.
Yeah, it dominates. People think breast, prostate, colon. You could put all those together, and it doesn't come close to lung cancer.
Why is lung cancer so deadly?
It's just, you know, we've never had a really good screening exam for it. There's chest x-rays, there's sputum, but we always catch it so late the game is over. And that's the beauty of the low-dose chest CT.
I keep hearing that over and over, regardless of the kind of cancer, pancreatic or whatnot. It's not that it seems like it's inherently more deadly, it's just you get to it too late.
If you catch it early, you're going to do a heck of a lot better. And that's what this study showed out of the National Cancer Institute.
Okay. Why is it so hard to catch early?
Because we just you don't feel it or see it until it's, you know, you're coughing up blood or you're losing a lot of weight, and then the horse is out of the barn, so to speak.
Okay, so let's talk about these CT scans. Why are they so good for veterans?
They're good for veterans. They're good for anyone with a serious smoking history, is because you can catch these nodules at a very early stage, 4 millimeters, whereas the study showed that for a chest X-ray, we weren't catching these things until they're much, much larger.
Okay. And is this dangerous for people who don't know much about CT scans?
There is a little bit of radiation involved, and that's why the studies show that it's not for everyone. If you're a 25-year-old kid, this is not the exam for you. But if you're a 55 to 75-year-old and you've had a significant smoking history, a 30-pack-year history or more, the risks of lung cancer far outweigh the risks of the radiation from the chest X-ray, or excuse me, chest CT.
Okay, and you know what? Let's go over that again. I just step by step, just in case people don't get it. So, what is the age range we're talking about here?
So we're looking at people. The study showed from 55 to roughly 75.
Okay.
People who have had a 30-pack-year history. Now, a pack-year history is, if you smoke 1 pack of cigarettes every day for a year, you have a 1-pack-year history. Now, if you smoke 30 packs, excuse me, if you smoke 1 pack a day for 30 years, you have a 30-pack-year history.
Okay, so that's a basic idea of whether you think you need to sort of qualify for this. Now, if you think you do out there, how do you go about getting a scan done today, doctor?
The first thing you need to do is you need to contact your doctor, because you're going to need an order. And that goes for pretty much anyone. Now, fortunately, to honor our veterans, we're providing the free service, so you need an order from your doctor, and you need a military ID, either active duty, reservist, or retiree.
Okay. How easy is it to get that order from the doctor, in case somebody's just finding out about this today?
If they know your history and the doctor knows your history, it's pretty easy. I don't think you're going to get too much argument.
Okay, that's good. How about setting up an appointment at one of those 3 locations?
You can give us a call at 860-714-2724, and we can set you up if you have all that together.
Is there a website, too, that we could throw up on foxct.com?
Absolutely, absolutely.
Okay, good. And where are the locations again? Let's go through that.
So we have offices in Enfield, Avon, and Glastonbury.
Okay, so you got a lot of different options for you right there as far as where to go. As he said, Dr. Biondi said, it's going to be pretty easy for you to go ahead and make an appointment, because we want to make this as accessible as we can. How much of a difference could this make? I mean, have there been studies that have been done to find out just what kind of effect a low-dose CT scan has on mortality rate?
That was what the National Cancer Institute, they did a long study with about 54,000 people in this study, and they showed that a low-dose chest CT versus an X-ray, having that decreases the mortality by 20%.
Okay, and there you go. You got the number on the screen one more time for you, 714-2724. Just from a monetary perspective, this is going to be one of the greatest freebies you can have, because depending on where you live, they cost anywhere between, I think, $100 to $400. What did you say, about $125 is what it costs for?
Yes.
And this could wind up saving your life, especially if you're within that age range right there. So, Doctor, thank you very much for your time.
I appreciate it.
Thank you so much, and please, folks, take advantage. Today is your day to do that. Well, coming up now on Fox